everybody's coming in. It's a great sunny day in New Jersey, where I'm at right now. We're going to be talking about feet, pain-free feet for the summer. And we're in the middle of it right here. We just had like a real hot spell, and you've probably been walking around either at the beach, the boardwalk, or out around town in flip-flops or something like that. We'll talk about why your feet might hurt. All right, hello everybody. Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Kachoa, and I'm with PAR5 Physical Therapy, and I partnered with them for an easy and educational workday session. Today, we're going to talk about how to get rid of those painful feet in the summer. So I've been a physical therapist for over 25 years, and I've received my doctorate in physical therapy from Mercy College in upstate New York, and a BS in exercise physiology from Rutgers University. I'm a board certified orthopedic clinical specialist and a Titleist Performance Institute certified level 3 golf medical professional. So hopefully you're going to find this session very helpful with a lot of informational tips for you. So we're going to get it started. If you have any questions during this, feel free to use the chat, raise your hand, or do something. Try and make this as interactive as possible. So I'm going to pull up my slide here. So we're going to talk about pain-free feet for the summer. All right. So because I'm a medical professional, I have to put this disclaimer up here that this is not physical therapy. This is not medical advice. It's just general advice targeted at a broad population to help you deal with foot pain. And if you're dealing with something specific, make sure that you get a physical exam from a medical professional to be able to treat and find out the root cause of your problems. Now, if anything, if you come to my sessions, you probably have seen this video, but I'm super pumped that I show everybody this, because this is the root cause of a lot of the issues that we're dealing with. The body functions on this alternating pattern of stability and mobility. If this pattern is disrupted, then pain or injury is the result. So if we're concerned about the foot needs to be a stable segment, right? That needs to be stable. It has an arch. That arch kind of collapses as you put weight on it and springs back as you step off and push off of that foot. But that should be a stable segment and should be moving and absorbing shock. And then the next joint up is the ankle. That should be mobile. And oftentimes that is not the case. Muscles and tendons and ligaments around that ankle, that joint can get stiff and tight and cause a whole bunch of issues. So when the ankle becomes stiff, that causes the foot problems. And then if the foot becomes too mobile, then that can cause like leg or ankle issues. So when the purpose or the role, if it's a mobile or stable segment of the body, if that is reversed or disrupted, then we've got issues. So a quick test that we can do is called the wall test. And what you're going to do is you're going to find a vertical surface, find a wall, could be any, could be a railing, the edge of your chair, whatever. Put your hand there and kind of put your toes right up against the hand. And I'm going to demonstrate this so we can kind of go through this. Now, your knee should be able to touch the wall without your heel coming off the ground. We'll talk about that more. And if you have good ankle mobility, then the hip, the knee can all function the way it's supposed to function. Oftentimes when I see clients in here, they can't squat to this position, it's because of ankle stiffness. Now, the big toe is also a key joint in the foot. That needs to extend in this angle here, and that's about 80 to 90 degrees. If we lose that ability for that toe to extend in that position, then we typically run into bunions. So there's a bunion right there. That's what happens when your body tries to get around a tight foot like this, a tight toe. And then we start to develop this. Now there is a genetic component to this, but we can reduce the progression of this bunion, because I think the only other way to solve that bunion problem is get surgery. So, but as we're stepping off, you're pushing off and you're trying to get that foot, that big toe has to extend into this angle to create a stable foot. And that's the arch. You see those green arrows there that creates that stable foot for the ankle, the calf muscle, and everything above that to work. So if we don't have this, we got issues with that plantar fascia, the tension that creates in there. We can wind up with bunions. We can wind up with this plantar fasciitis, which is usually like heel pain that's worse in the morning, better as the day progresses, and very pinpoint towards the heel. We could talk about how to find out if your foot is flat or not. And if you step on sand or step on a wet piece, a piece of paper with wet feet, or on your bathroom floor, you can probably tell what's your outline of your foot. And you know, all right, is it a high arch, a normal arch, or a flat foot? And if we run into a flat foot, typically we get too much pronation, and then we get this internal movement of the tibia, the lower leg, which causes issues with the knee, and then internal rotation of the femur, and that can cause hip or back issues as well. All right, so we're going to go into some stretching and soft tissue mobilization here. So let me get my 2-shot up here, and let's go over this this wall test first. Okay, so as you can see in my feet, I'm wearing flip-flops today, and if we're talking about the way that we're progressing, maybe I'll just kind of raise that up. As we're walking, this is what happens. So if I get my side view here, the problem with flip-flops is not because of the lack of cushioning. Most people say, oh, I need to have a shoe with a lot of cushioning. No, if your foot functions well, we should be able to walk around barefoot. Our ancestors were able to do this without an issue. So again, so here's my foot. My right foot is going to land. I'm going to plant. And then what happens is as I step forward through here, I get this movement where that big toe extends. So you can see how that big toe is extending, which normally should stretch out that fascia and creates a stable surface for me to push off of. So I can kind of push and propel myself off of that. Now, the problem with flip-flops is that you're in here, and to keep these on, you're flipping around. To keep these on, you have to kind of give it a little bit of a grip with the toe. I don't know if you could see that in the video, right? So if I'm stepping and I'm standing and I'm stepping here and I'm moving through and I'm going to do the same thing to keep that flip-flop from flying off my foot, I have to kind of give it a little bit of tension with my big toe. I don't know if you could see that in the video, but that tension, that little curl of your foot disrupts the ability for that big toe to extend and causes all the issues that we talked about up the chain. So if you're going to wear a flip-flop, I would only do them for short durations of time, and also try to get the flip-flops that have a very tight strap. All right, the strap that goes through here shouldn't be loose. The tighter you are in this area right here, the less your big toe has to kind of create that tension slipping down. All right, so the wall test I mentioned earlier, everyone should be able to get into this position. So let me see, and you can do this in standing. I'm doing this in a kneeling position for the camera here, but let's just say that this is my vertical surface that I'm going to be using. I have my foot, and I'm going to put my hand, the side of my hand, so that my toe is a hand width apart, or a hand width distance from that vertical surface. My heel is down, my foot's pointed straight. Now, I'm going to push this knee forward, and it should easily touch that vertical surface. And if I can't, then you know you're tight. And if you're trying this at home, make sure that if you're looking down at your foot, that your foot is straight and your knee is straight and moving in that same direction as your foot. Oftentimes, I'll show you the head on view that I'll do this test to people. They'll set up with their foot straight, and then because their ankle is tight, they'll move their knee like this. And that causes that pronation in that foot, and this is not a good position for that knee to bend, all right? The other thing too is that people will try and cheat, and they'll kind of go forward, and then, oh yeah, I'm touching the wall, but my heel's off the ground. All right, so if that's tight, we have this classic gastroc and soleus stretch or ankle stretch. I like doing it with an elevated foot. So keeping my foot on something like this half foam roll, or at home you can kind of use like a rolled up towel or a book or something. Kind of turn it this way. I'm going to get my ball of my foot here, and I'm going to keep my knee straight, and I'm going to bring my hip forward. As I bring my hip forward, I should feel that stretch in the calf. So that stretch should be somewhere around here. The other foot can go wherever you want, right? When I drive my hip forward, I'm just going to kind of feel that stretch. So that's one muscle in the lower leg. The second muscle, we unlock the knee, and then we do the same thing. I bring my hip forward, and that's going to get us a different muscle closer to the Achilles. All right, so 2 muscles in the lower leg, 2 different types of stretches, 30 seconds each. That's going to be the key to that. Now, if we move down into the foot, the biggest thing is and a lot of times people will have pain in the bottom part of their foot. So I have a lacrosse ball here. I also have a smaller foot massager ball, which is a little spiky. And what we're going to do, and you could also use like a frozen water bottle at home. I've had a lot of clients have good results with that. The frozen water bottle has a larger surface area as you're working through your foot. The balls have a smaller surface area, and you can kind of get into the little deep nooks and crannies of the foot muscle as you're working through here. So as you can see, I'm not going fast. I'm going as deep and as hard as I can tolerate and moving slowly. All right. As I'm getting through here, I'm going to search for any parts that are tight, and I'm going to spend a little bit more time working on them. I can go forward and backward or side to side. If I could do this in standing, that would be much more extreme. I can get onto this ball and get a little bit more direct into that as well. Again, 2 minutes for any soft tissue mobilization that you choose, whether with the ice bottle, the lacrosse ball, or this little massage ball. All right. The second piece is try to get this position, that great toe extension. So I could bring my lacrosse ball back here, and I could put that right under my big toe, as you can see, and I keep the knuckle of my big toe down on the ground. And then that should give me that stretch into that big toe. And I just move my knee forward, and I stretch out the ankle, doing the same thing that I was doing earlier with the wall test. Again, looking at where my foot's pointing, looking at where my knee's pointing, and I'm going to repeatedly go in and out or forward and backward of that motion for about 2 minutes as well. Now, you could certainly do that a different way, more manually, if you just kind of cross your legs and then you pull that big toe back. Let's see, from this angle, maybe you pull that big toe back with your fingers. Okay, so that's another stretch. If you're super tight, you can't tolerate that ball, we're just going to kind of do it in a non-weight bearing position, so you should feel that stretch there. Any stretch that we do where we're trying to elongate soft tissue, you should hold it for 30 seconds. Anything where we're trying to mobilize tissue, with like rolling or some type of joint mobilization or something like that, that's going to be for at least 1.5 to 2 minutes. All right, so those are the times, the bare minimum dosage times to create some type of therapeutic effect. All right, from here, the muscles in the foot are very analogous to the muscles of the hand. So if our hand can do this and move independently our fingers and thumb, we should be able to do that with our feet, our toes. So a lot of times, because we're always in shoes, it really takes our foot and kind of squishes those toes together, and we lose the ability to kind of utilize those muscles because we're always bound in one shape, right? So a lot of times I'll have a lot of clients work and try and walk barefoot as they can and see if they could separate the toes. So toe separation is key. I'll show you in this angle. I'll take my fingers and I'll put them in between my toes here. And I'm just going to hang out in this position and start to move those toes forward and backward, up and down, circles. Try to get the muscles inside the foot loosened up and create that separation. Toe separation can reverse the compressive strapping or restrictions that we usually get with regular shoes, with pointy shoes and shoes that we normally find. So once we get those toes moving and loose, then we can go do some toe yoga. So toe yoga is trying to move individual toes without moving the other one. So the easiest one is to just see if you can lift your big toe off the ground. All right, so these are going to be small motions and sometimes difficult to do on your own, but if you try and do them repeatedly, you'll get better and better at it as your brain starts to make that connection, reconnection back into those tiny muscles of your foot. So raising the big toe without scrunching the smaller toes. So you want to keep the smaller toes relaxed and then see if you can just lift the big toe up. And we could reverse that and keep the big toe relaxed and raise all the other toes. okay? Keeping the big toe relaxed, raise all the other toes. So that coordination, I have to look at my feet to do that, but that coordination there and that feedback will help reinforce those muscles to activate properly. So you have big toe extension and then the rest of the toes extension. And then you could try and separate the toes and bring them together. It's going to be much more difficult to bring them together. There's smaller muscles to that, but you could certainly separate the toes, right? Separate the toes and then relax, separate the toes. So those are some toe yoga. There's a lot more complex stuff where you try and go raising all the toes and try and only bring one toe at a time back to the ground. So if you lift all the toes up, see if you can get the pinky, the ring finger toe, middle finger toe, index finger toe, and then the big toe down. So you kind of like go as a wave, everything up, and then pinky, ring, middle, big toe, and then big toe. What is that? So we go from outside to in. So you can also try it from the inside out. That's much more difficult. Try to get the second toe down, much harder. Got to look at my toes to do that. But these are different exercises and drills that you could start to reawaken those muscles inside your foot so that when you're walking, the muscles can help support you and they can be more resilient as their functioning returns, right? Because we spend a lot of time, too much time, I think, in shoes that kind of bind our feet, all right? So the other thing too is I think I'll touch on a little bit about that pronation, right? So if I'm going to go here, a flat arch kind of like is where the ankle kind of just rolls in, we lose that arch. If you do that repeatedly, you can kind of see how my tibia, my lower leg bone kind of rotates in and then that knee goes in, the hip goes in. So every time that I find people like with foot pain and they have like a flat foot, usually I'll prescribe exercises that target the glute. The glute muscle up in here is typically weak with a lot of clients that I see, and it controls that knee position. All right, so if the foot collapses, which turns this tibia in, which moves that knee in, the only way for me to get that knee back into place is access the glute, activate the glute, make that stronger so we can make that correction to counteract that, that pronation. If you spend only your time trying to work on muscles in your foot to try and make your foot as strong as possible, they will never be as strong as the glute and never be strong enough to correct that pronated position in a weight-bearing position. So we think about runners, right? So runners undergo a lot of force when they're running and they're landing. And there's no way for the tiny muscles in the foot to create such a force to reduce that pronation as quick and as powerful as it needs to be versus the hip can do the job upstream. So if you're dealing with knee pain and foot pain, make sure that you start to do some of the things that we talked about here, but also don't neglect what's going on upstream, whether it's your knee or your hip, and make sure that your hip is as mobile and your glutes are as strong as possible so that you can support the limb where you can balance your body over that leg as you're walking, running, doing whatever recreational activities you do.